Welcome, everyone. Can you hear me? Yes. I'm Emil Rindersbacher, and I'm president-elect of the Retirees Association, so thank you so much for coming. Just a couple announcements before we get on with the program. First of all, I want to thank Parkview Church for letting us use this beautiful facility, and for the staff of Parkview for helping us film it and getting everything set up, so thank you, Parkview. Help yourself to coffee, cider, cookies. There's a lot of cookies I don't want to take home. So feel free to kind of come and go, and on your way out, take some. We will be posting a video of the speakers, so you'll hear the questions and answers, and I'll also then send you the slides that you're going to see. So you'll kind of have to listen and kind of look at the slides if you're interested in sort of referencing what was talked about today. Next Thursday is our next program. It is, I guess, November 15th. Dr. Chris Okishi, local child psychiatrist and theater expert, will be presenting a program at the Carryover Center for the Performing Arts from 12:30 to 2 o'clock. Chris is a wonderful lecturer, won many awards at the College of Medicine for his teaching, and his passion is theater. He's a writer, he's a director, he's an actor, and he's going to present a program on the current American theater. What's hot, what's not, and what's worth your time. Trust me, if you're interested in theater at all, this is going to be well worth your while. It's being sponsored by the Retirees Group. It's in the Performing Arts Center, which seats 450, so the public is invited. So bring your friends, and it's going to be at 12:30. Free parking, it's right next to the library, so parking can either be on the surface lot or underground. You can enter the theater on the ground level or underneath too. So, and I'll send out a reminder email with parking instructions probably tomorrow and then next week. And now to our program, let me introduce Jessica Wade, the Assistant Director of Benefits at the University of Iowa, and Lori Felger, who's the client consultant for the Alliance Health Medical Plans. And Lori will be joining us. She's on her way from another meeting, so I'll turn it over to Jessica and we'll go from there.
Hello, everyone. It's nice to see you. We're in the throes of open enrollment, so it's nice to step away from that and come talk to you. I'll be reviewing some information, and then we'll give some time for questions. And Laura Felger from Health Alliance will be joining us, so she'll provide some information about the Health Alliance plans, and she'll also give some time for questions as well. So we will get started here. Okay, so we are in open enrollment through December 7th, and we recently sent out some information that each of you should have received in the mail. You also maybe received some information from Health Alliance, so we'll be covering that information today. So during open enrollment, this is your chance to review your benefits and make changes if needed. And really those changes are restricted to changing health plans or dropping coverage. You are not able to add coverage during open enrollment. So for example, if you don't have dental coverage today, there's no opportunity to enroll for it. So just making changes to your current coverage if you need to. And if you don't want to make any changes, you don't need to do anything. So if you do nothing, your coverage that you have today will just remain in effect. And if there are any cost changes, the rates will update effective January 1st. So the plan options will remain the same for 2019. So your options through the university for health coverage include the UI Choice plan and then the two plan options from Health Alliance, the HMO plan and the PPO plan. I do want to mention that the Health Alliance plans are only available to those retirees who are eligible for Medicare. So if you're not yet eligible for Medicare, then UI Choice would be your only option at this time. And then we have the Dental 2 plan option for your dental coverage. So there aren't a lot of changes for 2019. just a couple to mention. For UI Choice, there is an increase in premiums, and we had sent out that information in late October. We've also provided a rate sheet today, so we'll take a closer look at that here in a bit. And if you are eligible for the university contribution towards your health insurance, if you were 62 or older with 10 or more years of service at retirement, that contribution is remaining at $288 per month for 2019. And that would only apply to your UI Choice coverage. Specialty pharmacy, there is a change here. So if you currently have a specialty medication that you take, or if you're prescribed a specialty medication in the future, you will be required to have that filled at UIHC pharmacies. Now this applies only to specialty medications. All other prescriptions you can still have filled wherever you normally go. And you might be asking yourself, am I taking a specialty medication? What is a specialty medication? These are very high-cost drugs that are typically injectable or an infusion. You would probably know it if you are currently taking a specialty medication, or if you're prescribed one, your healthcare provider will be working very closely with you to monitor that. There is a list if you would like to understand what a specialty medication is. If you visit the Wellmark website and go to the drug list that we use with UI Choice is the Blue RX Complete. And if you search that drug list, you can search by drug name, drug type, category. There is an indication there if something is a specialty medication. And that information is a little bit further in my slides, but when you get a copy of this, there's a link to the formulary. The dental plan, there are no changes for 2019, so the cost is staying the same as well as the coverage. So just some plan highlights for the UI Choice plan. This isn't really new information, but it's good to refresh each year. The UI Choice plan is a Wellmark Blue Cross Blue Shield plan, and it offers worldwide coverage. So you can use it anywhere you go, and you can use any provider with the plan. It is structured in a way that if you use certain providers, it's a better benefit for you. If you're Medicare eligible, you do need to be enrolled in Medicare A and B as your primary insurance, and then your UI Choice acts as secondary coverage. Regarding the tiered structure of the plan, there are 3 levels of coverage under UI Choice. Level 1 providers include university hospitals and clinics, as well as university-affiliated providers. So we have some alliance partners that are included within that Level 1 network. An example of that would be Mercy Cedar Rapids. There are some other local providers included in the Level 1, not Mercy Iowa City. Level 2 providers are going to be your Wellmark Blue Choice providers. So they are providers who participate with Wellmark, but do not participate, or they're not in the Level 1 provider network. So Mercy Iowa City would be a Level 2 provider under UI Choice. Any other provider would be a Level 3 provider, so that's going to be like your providers who are outside the state of Iowa, for example. Your out-of-pocket maximum under the plan, so this is the most you would pay out of pocket in a year if you are covered under UI Choice. It's $1,700 if you're using Level 1 or Level 2 providers, and that would also apply to Level 3 Blue Cross Blue Shield participating providers. So if you're outside the state of Iowa, but you're using a Blue Cross Blue Shield provider, that's going to be included in that $1,700 out-of-pocket max. Level 3 non-participating providers, you would pay a $2,000 out-of-pocket maximum. The prescription coverage, there are no changes other than the specialty pharmacy requirement. Tier 1 drugs, your generic drugs, are still going to be no cost to you. Tiers 2, 3, and 4, those are your brand name drugs. You will pay a co-insurance, 30% for Tier 2 and 50% for Tiers 3 and 4. You can determine what tiers your drugs are in by visiting the formulary that we talked about, the Blue RX Complete, and that is available on the Wellmark website. And the prescription drug plan has a separate out-of-pocket maximum. So again, this is the most you're going to pay in a year out of pocket. And once you reach that amount, anything beyond that will be fully covered by the plan. And the maximum on the prescription drug is $1,100 per person, or $2,200 for family. You might see some information about Medicare Part D plans. If you are enrolled for UI Choice, you should disregard any type of marketing material or someone who tells you you need a Medicare Part D plan. You do not need a Part D plan if you have UI Choice, and you should not enroll in one. You probably recently received a notice of credible coverage from our office, and this is a required notice that we send annually, and it just states that the coverage that you have with UI Choice and your prescription drugs is credible by Medicare standards. And the purpose of this is if you were to ever apply for a Medicare Part D plan, if you decided that you no longer wanted to participate in the UI Choice plan, that plan that you're applying for coverage with may ask for evidence that you've had credible coverage. So you would want to provide those letters as your evidence. We do suggest that you keep copies of those. I had a question in a previous session, what if I threw those away? And you can get a copy by contacting our office. I'm not encouraging you to throw them away, though. Some plan highlights with Dental 2. Again, there isn't anything changing, but just some good things to refresh. You can use any provider with your Dental 2 plan. It is to your benefit to use Delta Dental providers if you can. You'll likely pay less out of pocket, and if you use Delta Dental providers, they will file your claims for you. If you're using a non-Delta provider, you may have to do that legwork and submit the claims on your own, although those claims would be eligible for reimbursement under the plan. There's a $2,000 maximum annual benefit. So this is a little bit different than the out-of-pocket maximum that we talked about with the health plan. This is the most the plan will cover in a year, so $2,000 under the dental plan. There is a carryover feature, so if you don't use the entire $2,000 annual benefit, the remaining amount will carry over to the next year. So you would have more benefit available to you up to $4,000. The plan covers 2 cleanings and exams per year. If you are canceling your health coverage with us, there is an option to continue your dental coverage. Just a note on that. If you cancel your coverage, your health coverage, we do ask that you contact us in writing with that request. And if you would like to keep your dental coverage, just include that in your note to us. Okay, so we'll look a little bit at the rates now. So the university contribution, which is available to those of you who retired at or after age 62 with 10 or more years of service, that amount is $288 per month, and that applies only to UI Choice. So if you're eligible for the contribution and you have UI Choice coverage, that $288 is going to reduce your premium. but it cannot be applied to, say, the Health Alliance plans. I know we have some early retirees in here from the 2015 Early Retirement Program, and the rate sheets that we had available at the table are for our regular retirees, so if you need an early retiree rate sheet, we do have some available. Sanatina has them in the back. But your rates will be different through the end of your program, which will be sometime in 2020. Okay, so I've got the rate sheet kind of broken down on these slides. So this first slide, we're looking at the top portion of the rate sheet. And I know it looks kind of complicated, but we're trying to capture every family scenario. If you are covering your spouse, once one of you becomes Medicare eligible, we split you into two separate plans. So then your policy becomes a single policy. So many of you are probably either in a single Medicare eligible policy, which we refer to as the Medicare carve-out, or if you're not yet Medicare eligible but your spouse is, you're likely in the single, not Medicare eligible rate there. So the overall premiums increased 2.5% for 2019, but based on your family status and whether or not you received the contribution, your increase may be more or less than that. The middle of the rate sheet shows the rates for those of you who are not eligible for the university contribution. So that would be the full cost of UI Choice per month. And then we have the Health Alliance plan premiums, which for the HMO plan will be $56 per month and $300 per month for the PPO plan. So a slight increase there. I believe this current year, those rates are $53 and $286. And then the Dental 2 premiums, which are not changing. Laura's going to be providing some more detail around the Health Alliance plans, but if you decide that you want to enroll for one of the Health Alliance plans, you do need to apply directly with Health Alliance. I know that they sent applications in the packet that they mailed out that most of you probably received. We also have applications on our website, or if you need us to, we can send you one. You can also enroll with Health Alliance over the phone. I think it's a pretty lengthy phone call, but it is an option. And if you do enroll for a Health Alliance plan, you will be billed directly by Health Alliance. So the university bills for the UI Choice plan, but the Health Alliance billing is separate. If you elect Health Alliance, but you're staying on the university dental plan, we will still bill you for your dental coverage as we do today. A couple of things to mention. If you are Medicare eligible and you are covering your spouse, you can be enrolled in any combination of the 3 university retiree health plans. So for example, one of you could have UI Choice and the other one could have one of the Health Alliance plans. You also have the option each year to move between any of the 3 plans. So you could elect a new plan every year if you wanted to. There is no limit to that. So if you wanted to try one of the Health Alliance plans for a year and it didn't work for you, you would have the option to come back to UI Choice. If you are eligible for the contribution and you move to a Health Alliance plan but come back to UI Choice later, you do not lose the contribution. We've had that question come up a couple times. So next steps, we ask that you review the information that you learned today, the information that was mailed to you, consider your options and make the best decision that you can based on your needs. There is a great resource here locally, the SHIP office, Senior Health Insurance Information Program. They are located at the Senior Center and also at Mercy Hospital, and they provide counseling on Medicare and Medicare supplements. So if you'd like some more information or you need some one-on-one assistance with navigating through your options, they do a really nice job. If you don't want to change anything, you don't need to do anything. Your current coverage will continue. If you are making changes, we ask that you notify us in writing. You can send an email, that works well for us. And again, you can continue your dental plan even if you don't keep our health plan. And just a reminder that Health Alliance has a separate application and billing process. So you do need to work with them if you'll be applying for one of the Health Alliance plans. And then this is very important. If you have UI Choice and you are continuing UI Choice for 2019, Wellmark is sending new ID cards to all UI Choice members. And these ID cards will have a new policy number. So it's really important that you provide that new policy number to your pharmacy and to your healthcare providers so that they have that. And Wellmark has promised us that they will be sending everyone those cards by January 1st. So watch your mail in December for your new cards, and you'll use your current card through the end of December, and then you can throw it away, and you'll want to start using your new card on or after January 1st. And pharmacies don't always ask for your card, so they probably already have your information in their system. So they might run your old policy number and tell you that you don't have coverage. So please don't panic, but just be sure to provide them with your new insurance card and policy information. Okay, so I will take questions now, and then Laura will arrive and she'll present her information, then we'll give some more time for questions once she shares what she has to share.
I'm on phased retirement. I just came here for information. Both my wife and I are currently UI employees. When we sign up, do we have to get this, one plan or a separate plan to take advantage of the $288 or?
So you're currently on phased retirement?
Yeah, and I'll be done in May. I was just wondering, I'm looking at this plan. It says retiree and spouse, both on Medicare. It's $1,432. But can we get two separate plans? It's cheaper.
Is your wife also a university employee or retiree?
She will be soon. Yeah, she is. She works for the university.
And are you both eligible for the contribution?
We should be. Been here like 36 years. So.
Okay. So yes, you would be on two separate plans. And if you're both Medicare eligible, you would be paying the $428 each.
Okay, well, that's cheaper. It sounds good.
All right.
On the carryover, is there a maximum that it can come to? I mean, if you're
On the dental plan?
the dental, yeah.
Yeah, it's $4,000.
4,000. Okay.
And you do actually have to use the dental plan in order to receive the carryover. So you have to have at least one claim during the year, even if it's just a cleaning.
And very quickly, the coverage on the Tier 1, you mentioned throughout the state of Iowa, that still hasn't changed, and the bordering counties, is that correct?
The bordering counties of Iowa?
Or Tier 2, correct, on the, for the coverage on the UI Choice Insurance. There was always some thing about the state of Iowa and every bordering county.
I don't know that I've heard that.
Am I losing my mind?
Julie, we have Julie from the Health Plans Office here. Anything to add on that?
I believe it's level 2. I would, and probably also Sioux Falls, the Sanford Hospital in South Dakota. Okay, okay. And the second question is that what would be the procedure, what would you expect people to do that don't live close to Iowa or any of those bordering counties? Let's say someplace out in Washington State, you have UI choice coverage. What would be the small or the things that you should probably do to visit your local hospital to make sure you do have coverage? Because I'm sure all the hospitals vary on whether or not, obviously you'll look online and see if they accept UI choice. And am I out of bounds here to think that you should also be asking if they take balance billing? In other words, will they accept the whole payment and you don't have to come up with the balance, whatever that bill would be?
So if you live outside the state of Iowa, or if you're traveling outside the state, you can search for a participating provider, and that there's a search function on the Wellmark website that you can search for national providers. And so I would recommend that you find a participating provider in the national network, and they cannot balance bill.
Yes, I have a question about UI choice. Why is single not Medicare eligible less than single Medicare eligible?
So the Medicare eligible rate is higher than that of those who are not Medicare eligible because it's a different pool. So the not Medicare eligible population is included in the population with all of our active employees. So that's a very large population, a large risk pool, where our Medicare eligible retirees are in their own pool, which is a much smaller and older population. So those premiums are based on the utilization of the people who are participating in that particular pool.
Thank you.
You're welcome. Okay. I'll have you repeat that in the mic, sorry.
Okay, so, I'm sorry. I'm just going to follow up that you said that when we're Medicare eligible, we're put into a different group, which of course is smaller, includes people our age or older. Is there why was that decision made to put us in a different group? Why were we not just left in with the rest of the university employees?
Well, unfortunately, I don't know the answer to that because that was a decision made above me, so.
I think it'd be a
can't.
good thing to investigate why that is. It seemed odd to me that once I went on Medicare and Medicare was my primary insurance, that my UI choice was more expensive.
Right, I
So,
agree that
yeah.
it doesn't seem logical.
Right. I just seemed like that would be something that would be something to look at and have an answer for
Yeah.
sometime.
I mean,
Thank you.
Yep. Yes,
You have new cards coming sometime during December. If you're out of town, if we are out of town when the card comes and not getting back until sometime beyond January 1, and there is a medical need, what do we do?
if you need your policy information, excuse me, prior to returning and having access to your mail, If you have a My Wellmark account online, you can access your policy information through that account. If you don't, you could register for one now. You can do that at any time. If you're in a pinch, you can always call our office and we can help with your policy information. We should have access to it by late December. So if you need it and you can't get to your mail, please give us a call.
Okay, and one other small question. The immunization information says zero copay. Is the Shingrix vaccine included among those?
Yes.
Thank you.
Are there a change in co-pays? I am on Medicare, and I have never paid a co-pay before, either for hospitalization or for office visits.
Okay, that's a good question. So one of our handouts, this one, is a 3-plan comparison. And this shows side by side how different things are covered under UI Choice and the 2 Health Alliance plans. So under UI Choice, you do see where there's co-pays and co-insurance amounts. And you also see that with the Health Alliance plans. With UI Choice, if you are Medicare eligible, you have your Medicare as primary and your UI Choice as secondary. And so most of you probably experience that you're not really paying anything out of pocket when you go to the doctor. And that is because your Medicare is primary, it processes those claims first, and then what's left, what Medicare doesn't cover, that gets processed through your UI Choice plan. And with those 2 insurances and the coverage, normally it just happens that you don't pay anything out of pocket. That's not a guarantee across the board. There are situations where you may have to pay some out of pocket, especially if you're using a non-participating provider, for example, or if there's a service that Medicare doesn't cover, but UI Choice does. For example, hearing aids, you will have some out-of-pocket cost. But for the most part, you're probably seeing that you're not paying those co-pays or those co-insurance amounts if you have UI Choice. Now, for the Health Alliance plans, the Health Alliance is a Medicare Advantage plan, so you don't have 2 insurances. It's a bundled insurance. So where you're seeing on this sheet, if you see co-pays and co-insurance amounts under the Health Alliance plans, you will actually pay those amounts out of pocket. So that's a difference between Health Alliance and UI Choice.
I just have to say, when you mentioned the hearing aids, I have UI Choice, and I had a very positive experience with obtaining hearing aids with their $2,000 ad, and I just wanted to say that. So if you have any questions, see me later.
Thank you.
Hi,
Hi.
I'm part of the early retirement stuff from 2015, and
Yes.
I'm now looking ahead to 2020 when that's over.
Mm-hmm.
It started in the middle of the calendar year in 2015. Does that mean that in 2020 I have to make all these decisions again in June or July, or does it continue on until the end of 2020?
So you'll have to make some decisions at the end of your early retirement program. And that will be considered like a qualifying event. So you can make changes at that time. Also, sort of along with that, if you are not yet Medicare eligible, but you will be becoming Medicare eligible in 2019, you don't have to make decisions during open enrollment about your coverage later on next year. We'll get in touch with you prior to your 65th birthday and give you some guidance around what your options are. The same is true for early retirees, so we'll be in contact with you in early 2020 to communicate about your options and give you some guidance as to what your options are once your early retirement program ends. Good question.
Could you repeat again? I'm already on Medicare and UI Choice. Who needs to see the cards when they're mailed to me? In other words, I'm getting a new card of some sort in the mail, is that correct?
Yes.
And where do I take those? Could you list them again so that I don't forget somebody and all of a sudden find that I've got a premium that I could have avoided or something like that?
Yes. So when you receive your new card, you should bring that along with you to any doctor's visits or when you're filling prescriptions. Yes. I can't think of anyone else other than your current healthcare providers. If you're Medicare eligible, you'll also have your Medicare card. So if you have UI Choice, you should be using both cards for any medical services. We'll get a mic over to you. I know everyone loves talking into the mic.
I just wanted to clarify, you do consider the early retirement a qualifying event? When it ends, I mean, yes.
Yes, so at that time, if you're currently on UI Choice and you wanted to switch to Health Alliance, for example, you would have that option effective whatever the first of the month is after your program ends.
Okay. Does that apply, like, if you go outside the university, Medigap, if you go to Medigap?
You can apply for a Medigap plan anytime.
Right.
If you're outside of your initial enrollment period, you would be subject to medical underwriting from that new plan.
Okay, so it's not a qualifying event for another?
Yeah, it's not a special enrollment opportunity, as Medicare refers to it,
Okay,
for a Medigap policy.
okay, thanks.
You may have already covered this, and I might have missed it, sorry. I had heard from someone else that if you wanted to stay on Health Alliance, you needed to apply every year. Is that correct? Or if you stay on the same insurance you had, whatever the policy was last year, it'll just carry over?
Yes, if you don't want to make any changes, you don't need to do anything. If you were applying for a new Health Alliance plan, an application would be required, but not every year. I think we've got one over here.
Is there a lifetime max on the amount of money that's paid out by UI Choice or Medicaid for that, Medicare for that's concerned?
A lifetime maximum?
Yeah, it's like if you get in an accident and you have $5 million and then it keeps going on. Is there a lifetime max with UI Choice?
There is no lifetime maximum on the plan.
Okay, thank you.
I have a quick question about dental. I'm currently on Larry's policy. If I wanted to carry my own dental policy, when would I have the opportunity to do that?
Are you also a retiree?
Yes.
So we can enroll both of you in a single plan.
Okay.
We just need a request in writing. You can send us an email and we can do that.
That would probably save us money then. I mean, a little bit, right?
The single coverage is $45 a month and retiree plus spouse is $93.
Oh.
And some years it could be different. So some years it's to your advantage to do that, but
Yeah.
other years it might not be.
What happens? Oh, never mind. I'm good.
Okay.
Thanks.
Did
Did I hear you say that if we're happy with what we have now, that we don't have to do anything for next year?
That is correct. If you do not want to change anything, if you're happy, you want to stay where you're at, you do not need to do a thing.
Thank you.
Yep.
My wife worked for the Iowa City School District. She's going on Medicare this year. And so it's the changeover there. But what about on the dental? What happens with the dental since they're apparently stopping the dental program for the Iowa City Public Schools retirees?
So she is on the retiree dental plan?
She's on the Iowa City retiree
Okay.
dental plan.
So there would be no option for you to pick her up on our plan. The only way to add someone to your plan is if they've had other employer-based coverage, like through active employment.
Yep.
That is ending. So retiree coverage would not be considered active employment coverage. So she wouldn't have the option to come onto our plan. Delta Dental does sell individual policies, so you may want to get in touch with them to see what they offer.
Okay, so that's not the same as if they were on a health care plan with the Iowa City Schools and then joined if they had canceled that plan?
That would be the same situation. So you can only join our plan if you've had active employer-based coverage that ended, which would not include retiree coverage.
All right, okay, thank you.
Mm-hmm.
I'm another of those people who's happy with UI choice, and I just want assurance that it's not likely to go away. It doesn't sound like you're thinking about it going away. I was wondering if you could just give me some sort of notion about the relative number of people in the 3 different plans.
Sure. I actually just looked at this morning. This question came up last year. We have about 2,500 retirees on UI choice, and that number really isn't fluctuating a lot. We do have some who are leaving the plan, but we also have new retirees still coming onto the plan. And we have about 500 retirees on the Health Alliance plans, and that's split pretty evenly between the PPO and the HMO. We saw a huge increase in enrollment last year in those plans, partially due to taking on the former Merit employees who were on the state of Iowa plans that ended last year. A lot of those retirees came back either to UI Choice or the Health Alliance plans.
Just a comment, I have a comment on the Delta Dental. I had dropped Delta Dental a number of years before I retired, and so I decided, well, maybe I'll try to reapply, and they said, no dice, you dropped it, you can never get it back. So anybody that has Delta Dental and is expected to keep it, don't drop it now. Not that I think it's a good idea not to drop it, but anyway.
Yeah, the same holds true for the health plans. If you were to leave either the dental 2 plan or the UI Choice plan, you would not have the option to come back, only if you went with the Health Alliance plan. But if you go completely outside of the university, then you wouldn't later have an option to come back.
This is kind of just a what if. Say you chose one of the Alliance plans and all hell broke loose and you were in the hospital, hundreds of thousands of dollars. You are guaranteeing that you have the option to go back to UI Choice at the next benefit meetings.
Yes.
Do you anticipate that ever changing?
Well, it's hard to say because nothing is a guarantee, and it's reviewed each year. I don't anticipate that changing in the short term.
Okay.
I didn't mention this, but the other handout that we had available, we created this in response to some questions that we received last year at this meeting, and it talks about the eligibility guidelines for our retiree coverage, and I know that's one point that we have added here. that you can switch back and forth an unlimited amount of times. Just annually at open enrollment is when you have your chance to do that.
And the one thing I want to throw out here, and it seems like I'm maybe about the only outsider that lives outside the state of Iowa. I'm starting to see that. But if you ever have a claim outside of Iowa, you will, wherever, a clinic, a hospital, I can assure you that probably 90% of the time, that hospital will mail the bill to Blue Cross and Blue Shield of whatever state you're in, which is completely wrong. They can't get it right until you take a little mallet in and keep hitting them in the head and tell them that they have to send it to Blue Cross and Blue Shield of Iowa. That has been I live in Omaha, Nebraska, so that's almost literally every time, and I walk in, he'll say, oh, we're going to send it to Nebraska. No, that's wrong. And when I initially claimed on UI Choice, it was actually a quite nasty conversation on telling them that you have to send it to Iowa. So wherever you're at, if you're retired in Florida or messing around in Arizona and have a claim on it, make sure that you tell them that they have to send it to Blue Cross and Blue Shield of Iowa.
Okay, good to know. Julie, do you have something to add to that? Do you mind talking into the mic?
Thank you. Actually, when you're out of state, there are some Nebraska hospitals that do have a contract with Wellmark, Blue Cross Blue Shield of Iowa. In that case, they would file directly with Wellmark. Well, they should. But generally, when you're out of state, the hospitals or providers need to file with their local Blue Cross in that state. It needs to start there because they have to get the pricing on the claims, and then from there they come to Iowa to determine the benefit. Then I would like, if you ever have that come up again, I would appreciate you calling me, because I work a lot of those out-of-state claims, and so, yeah, so if you ever run into that, yeah.
They even knew about it. They even knew about the claim. But I said, well, now, why don't you guys work together and just forward the claim from Nebraska to Iowa? She goes, we can't do that. She goes, it has to come directly from the provider. Now, this was 2 years ago, a year and a half ago.
Okay. Because I know there are some Nebraska hospitals that contract directly with Iowa, Wellmark, but there's many out-of-state providers, and most do not.
Right.
And so it does have to go through their local Blue Cross, like, say, Florida. It needs to go to Blue Cross Blue Shield Florida first, and then on to Iowa, and then back to Florida. So if you ever run into that.
You have a flow chart for us so we can.
Yeah, really?
Maybe an interpretive dance.
Yeah, but I'd be happy to talk with you if it ever comes up again.
I think right here.
So excuse me, I have a question about making sure that I have my Wellmark card by mid-December, because I'm going out of the country for a month.
Okay.
Should I contact Wellmark like soon, right, very soon, or should I go through your office?
So they will not be receiving information from us until after open enrollment. So right after open enrollment, we'll be providing them with all the information about who's going to be covered for 2019. And from there, they'll generate the new ID cards. So I would think that it would be closer to the end of December that...
I will be out of the country.
Okay. So you can log into your My Wellmark account for your new policy information, or you can call our office or email us and we can get it to you.
Okay, I would need it by the middle of December.
I don't think it's going to be available by the middle of December. But if you get in touch with us before we have it available, we can follow up with you as soon as we have it.
Okay.
Do you have access to email?
Will I?
Yeah.
I believe so. I'll be with my daughter, and she has email.
Okay, yeah, we'll make it work.
Okay, well, hopefully I won't need it.
Yeah. Okay, it looks like that's all of our questions, and I know Laura is on her way. Sanatina has confirmed that. So I guess we'll have a little intermission here while I pull up her slides, and she should be arriving very soon. And if you have individual questions, feel free to come see me or Sanatina.
But I am here now, and it's really going to be kind of a fast update if you're interested in Health Alliance, because there really haven't been hardly any changes this year. So again, just to introduce myself, I am Laura Felger. I'm the Community and Broker Liaison for Health Alliance up in here in this area. I live in Bettendorf, thus should have been a 52-minute drive, turned into a lot longer today. And I've been with the company for 5 years. If you're familiar with Health Alliance, or if you're not, we are a full-service health insurance company, but we are a regional health insurance company, which means we do not do business in all 50 states. We try to stay mainly here through the Midwest, state of Illinois, state of Iowa, Indiana, Ohio, but then we've also got plans out in the state of Washington. Our home office is in Champaign, and I'm just going to run through the plans that are still available here with the retirees. This is our 5th year offering you the 2 different options outside of UI Choice under your University of Iowa retiree umbrella. Both of these plans are Medicare Advantage plans. And if you're familiar with Medicare Advantage, that is Medicare Part C. So your A, your B, and your D, and then all of your supplementary needs are packaged into one plan called Medicare Advantage. You do not have to show your Medicare card when you go to the doctor. You just show your Medicare Advantage card, and it looks a lot like being part of a group plan like you had when you were still working. You do still have to pay your Part B as in boy premium, and that's all really that is required in order to be enrolled in a Medicare Advantage plan. Proof that you have Medicare A and B. And the only 2 diseases that are considered exempt are Lou Gehrig's disease and end-stage renal. If you happen to have those prior to enrolling, you cannot enroll in the plan, but there are other options available to you. But if you happen to unfortunately come down with either of those while on the plan will cover you in full. We offer one of each, a PPO and an HMO. The difference is an HMO has a closed network, and you need to see the network of doctors that are offered under the plan. And the PPO gives you the added ability to see out-of-network doctors, including outside, other than what's in network. So here's the premiums for the 2 different plans for 2019. Maybe. I'm looking at the wrong screen. There we go. The HMO will be $56 a year, a month this year, and the PPO will be $300. There are no medical deductibles on either of the plans, so the plan pays from the beginning, and the maximum out-of-pockets are the same as last year. $4,000 for the HMO, $1,700 in-network, $2,000 out-of-network for the PPO. Very, very little change in the co-pays and co-insurance structure. The only change that I will point out to you is the emergency room co-pay on the HMO went up to $90. Everything else is identical to last year. And that is very hard to see, and I apologize for that. So if you need to see a primary care doctor on the HMO, it's $10. It's $5 on the PPO, and so on and so forth. The drug formulary, I have copies if anybody needs one. Otherwise, you can find them online on our website. The formulary is a tiered system. Our tiered system is 5 levels. The lower the tier, the lower the cost of the drug. So your generic tier 1s are your least expensive drugs. There has been no change in the copays on the formulary. So $0 drugs at University of Iowa and Walgreens on the HMO side, $0 anywhere for tier 1 drugs on the PPO. The coverage gap this year is set at $3,820. So if you accrue a total expense of $3,820 of drug cash outlay. That includes you and your plan, so it's the combination of what you're paying and what your plan is paying. You go into the coverage gap. While in the coverage gap, you're going to pay 37% of the cost of the drugs for your generics and 25% of the cost of the drugs for name brands. This is on the HMO plan only. The PPO has the same structure as UI Choice, by the way. And then on the coverage gap, it continues to calculate your out-of-pocket, and if you hit 5,100, your side of the expense only, not the plan side included, you go into a third level called catastrophic, where you pay $340 for tier 1s and 2s, and $8.50 for tiers 3 and above. Anybody have questions about coverage gap? We can talk about it after the meeting. If you're on the HMO, you need to be aware of this. But if you're on the PPO, you simply have a maximum out-of-pocket of $1,100, and then the plan pays 100%. So you'd never get close to that $3,820. You can order by mail and get a discount of 2.5 for the price of 3. If your doctor is willing to write the 90-day script, you can fill them that way as well. We offer extra benefits with both the plans, and that has not changed from last year. You get the $360 to use towards your gym membership, and then Assist America, which gives you your travel coverage if you're out of the country. And then Wellness Rewards is a $50 reward for healthy behaviors, and $200 a year to use towards dental. That $200 can be used in conjunction with your dental too, if you have that through the university. You can use up to $200 from us to offset any expenses that your dental coverage did not have. Otherwise, if you're just going to have the Health Alliance dental coverage, we'll pay up to $200 of anything you incur. We have an appeals and grievance process, as do all companies, and I encourage people to take advantage of that. And this is how you enroll with us. You would not be enrolling through the university and getting a U-bill. You'll actually be enrolling with us, and we would send you the bill directly. And we accept all forms of payment just like any other insurance company does. And you can call over the phone and do that, or you can mail them in. There are applications in the back of the packets, and I have packets with me if anybody needs any, as well as the university has a stock in their office. I know I went flying through this, but I wanted to be respectful of your time as much as I can since I was late. But anybody have any questions? Yes, sir. You get emergency and urgent coverage no matter where you are. What you can't have is an out-of-network physician somewhere else. Let's say you decided you wanted to winter down south and you wanted to keep a primary care physician wherever you may be living for that period of time. That's considered an out-of-network physician. But if you had any kind of urgent or emergent thing come up on the road, that includes everything from a really bad cut to, sinus infection, whatever your needs are, you can go to an urgent care or an emergency room and receive covered service.
Where can we find a number for Assist America? It doesn't use our usual Health Alliance number to enroll.
So Assist America, you can go online to assistamerica.com, and then your member number is your Health Alliance member number. And if that's not working, I'll help you with it after the meeting.
That is not working.
I've used it, and it worked for me, so we'll see what we can do for you.
So could you give I'm right over here.
Oh, hello.
Could you give a little more detail on how your region is defined, since there's a 6-month requirement to live within the region to get coverage?
Oh, yes. That is a rule for what I would call our mass market Medicare Advantage plans. You do not have to live really anywhere for 6 months in order to qualify. It's up to the discretion of the university as the group insurance provider to determine whether you're eligible or not. So you don't have to follow that residency rule.
Is there a simple thing way you can describe the difference between the PPO and the UI choice? Or major places where they differ?
Well, we tried to build our PPO to match UI choice as closely in coverage as possible. And so I guess the difference is that the PPO is going to be the primary and only payer, whereas UI Choice is secondary payer to Medicare. So chances are on the UI Choice plan, you won't have to probably pick up any of those co-pays because it's going to be coming out in the wash, whereas on our plan, you will pay the co-pays or co-insurance. I guess that's the biggest difference. Yeah. Yes, ma'am.
And I called this morning to find out what the status was because they've been in for many months. And I understand that you moved.
We did. We have a brand new corporate office.
And so all of these, I was going by the address in my book, so everything went to that 301 Vine Street. But I've never gotten them back. But do I have to resubmit all those, or eventually are you going to get them?
Well, Champaign-Urbana isn't that big. You'd think they'd know where to find us if it said Health Alliance. How long ago? We moved in April, so I don't, do you have copies handy? No? Not here. I'd give them, this is also a crazy time of year for just mail. We're getting applications, for all of our plans on the Medicare side and on individual insurance because it's ACA open enrollment as well. So chances are it probably is in a giant pile of mail. I know that's kind of irritating. I'd wait maybe till December 1st. But I wouldn't let the year go by. I'll give you my card and I can help with tracking things down as well, if I can. Or hand deliver what you can send to me. Yes? Okay, the co-percentage or co-insurance is the percentage of the contracted rate that Health Alliance has reached with that particular provider. That's not going to be the same for people who have other kinds of insurance because all insurance companies negotiate those rates. But ours is going to be pretty darn close to what Medicare says the rate is. So it's going to be the Medicare rate, and you're going to pay a percentage of that Medicare rate. When you get a bill and it says your bill, you owe $1,000, contracted rate $900 comes off, and you had that $100 left over. That $100 is going to be where the co-insurance is calculated from.
100 is the 10% then?
It'd be 10% of that 100.
Oh, 10% of the unpaid balance between. Okay.
Yeah, so it's
$10 in that case.
It's always going to be, I hate to use the word retail, but it's going to be their retail cost minus the contracted rate, that balance, 10% of that balance. Yeah. Yes. One slide. Appeals? Extra bennies? Okay. She just wants to read it. Any other questions? Yes, sir. It's automatic. And like I said, it is your Health Alliance member number is your number at Assist America. I have an app on my phone that I'm going to show you after the meeting, and yeah, all I had to do was enter my Health Alliance number, and then it came up and said, "Hello, Laura Felger of Health Alliance, welcome." And yeah, yes. In fact, what we recommend is if you get into a situation medically out of the country, you call Assist America instead of us. They are a third-party negotiator on behalf of you and us to get you the care that you need, get you the transportation you need to get home, and they will stand in between then the cost negotiations that have to take place. You will be held accountable for your copays and coinsurance, but then Assist America works through that process. All right. Thank you all. I appreciate you sticking around and wait until the end. I will have business cards, and if anybody wants a formulary or a packet, we'll meet at my trunk. It'll be fun.
And Sanatina and I will stick around for a little while as well if anyone has any questions. But thank you all for your time today. It was great seeing all of you, and we appreciate your attention.